Hey guys, Don Ricci and Neil Fishbein here at Waxman's Gym. We are doing part 2 of our mobility series with the Myorope. Last week, if you remember, we worked specifically the hip area. This week we're going to go a little bit further downstream, specifically working on the quad and IT band. So I'm going to hand it off to Neil to give you a couple of exercises to work on in the following week. Neil?
Thanks, Don. So we're going to use the Myorope in a similar way we used it last week. Things we did with the hip. This time we're going to look towards the quad and the IT band. We're really going to use 3 different approaches, and you can use these in any combination that you see fit. One is to use the Myorope as a roller in the direction of the muscle tissue. So in the case of the quad or the IT band, we're going to roll up and down. Then we're going to turn the Myorope sideways, and for a different approach at some of those tissues, you can roll across them. And then finally, we're going to actually fix the Myorope itself, and rather than using it as a roller, we're going to roll our body over the Myorope. So I'll show you what that looks like. So first we'll put it down. Using your body weight, resting the quad on top of it, I'm going to roll up and down. If this is too intense, you can put your foot on the ground and absorb some of your body weight with your toe, and of course with your upper body. To make it more intense, you can lift the toe off the ground and make sure that there's more concentrated pressure on the quad, or when we do the IT band, on the IT band. And we're going to turn it sideways, and of course you can roll across the muscle to get sort of a different approach. This is tougher to do with a foam roller. If the foam roller is relatively large, it tends to put your leg at a strange angle. Since the Myorope's low to the ground, it's a little easier to do it this way. And then finally, if we turn it back around, rather than using it as a roller, you can actually roll your body over the Myorope, and this tends to get you access to things in there that you didn't have access to using the other approaches. For the IT band, similar kind of approach here. You're going to put the non-working leg on the ground with the knee up, and then you can lean on the IT band and roll up and down. You can turn it sideways like we did, and we can roll across the IT band for a slightly different effect. And then again, moving it back this way, rather than using the Myorope as a roller, you can roll your body over it, getting into the IT band in a different way. So that combination tends to work well for most folks. The one thing I do want to remind people is, especially with the quad, with the IT band, other muscles that have some length, you want to make sure that you're not just working the center, but you're working the end ranges as well. If you've got tightness or soreness, making sure you work the top end as well as the bottom end, in addition to the middle, may help bring you some relief.
Thanks, Neil. So there you guys have it. Week 2 of our mobility series with the Myorope. We love your guys' feedback if you have any. Stay tuned for next week. Thanks, guys.